Hey Esties, we're back with another video, and in today's video I am doing a decongestion facial on a client who has a very interesting diagnosis. I did not diagnose this client with this. Honestly, if I had the authority to diagnose her, I would not even know. I wouldn't have came up with the diagnosis she was given. This client, she has something called hidradenitis suppurativa. And I'm not going to talk too much about what that condition is, but I'm really going to put a lot of emphasis on how an esthetician can treat this. Hidradenitis suppurativa is not acne. However, it is very similar to acne. All right. And so if you have a client who comes in with this very rare condition, usually hidradenitis suppurativa is not found on the face. That's why I said if I had the authority to diagnose this client, I would not have given her that diagnosis because I've never seen hidradenitis suppurativa on the face. However, she's been to a couple of dermatologists, and the one that gave her a diagnosis said that was hidradenitis suppurativa. All right. And so when we get a little bit closer up, you'll be able to see her skin and how that has impacted her skin. But to start off her decongestion facial, I'm going in with an enzyme cleanser. And I'm just steaming this cleanser, letting that enzyme activate. And then I'm going to actually let it set for a little bit to absorb some of that excess oil. Enzymes are really gentle on the skin. Enzymes, they exfoliate the top surface of the skin. Sometimes they're paired with different antioxidants and, other different actives to help brighten the skin and also help decongest the skin. But the main benefit of an enzyme cleanser is decongesting the skin while gently exfoliating the skin. And so as you can see, I'm just working this into her skin, letting it do its job under the steam. Whenever you're massaging in some kind of exfoliant, you're also helping the penetration. So I'm moving this enzyme around so that it can decongest, but also so that it can break down any of that dead skin and that keratin accumulation that could be causing some of the breakouts, some of the dry, flaky patches. And once I remove this cleanser, you'll be able to see up close what her skin looks like. She has a lot of scar tissue, and some of that dead skin can be lodged into that scar tissue. So this was why I went in first with that enzyme cleanser, because I want to make the job a little bit easier for me to go in and extract. Let's take some time out to talk about the benefits of a decongestion facial. Before you send your clients home with proper home care, before you start administering chemical pills and different corrective treatments, you want to make sure that your client's skin is free of any comedones. Yes, you can do extractions before you do a chemical peel. You can do extractions even during an acne facial, but sometimes clients need a little bit more than the 10 or 15 minutes offered in these protocols, right? So a decongestion facial specifically focuses on deep cleansing, gentle exfoliation, and then going straight into the extractions. You spend a little bit more time on extractions. And honestly, if your client is prone to acne, if your client is prone to inflammation, you could even incorporate things like LED light therapy to rehabilitate their skin. This is not a corrective treatment, but more than anything, I'm going to say it's a rehabilitation kind of treatment. You're literally removing the congestion that's there and then rehabilitating the skin so that it can be in a good place to receive all of that good home care that you're sending them with, or to prepare them for the corrective skincare, like the different chemical peels and even some of the micro needling and, all of the different enzyme peels and nano fusion, all that fun stuff that we like to get into. A decongestion facial can be done every 2 weeks until the symptoms start to subside or until the congestion starts to gradually go away. And a decongestion facial should not be anything under $75. All right? If it's taking you an hour to cleanse, steam, and exfoliate the skin, extract, and then nourish the skin back to health, I'm going to say that service should be about $75. If you start adding things in like high frequency LED light therapy and, other modalities like the cold hammer or something like that, then you should definitely upcharge. You should take that facial up to maybe $125. So I would say a decongestion facial, it ranges from about $75 to about $150, depending on the products you're using and then the different modalities you're incorporating. I'm going to be honest, I don't think that the modalities should be added in as like an upcharge. I think that the modalities should honestly just be built into the service. I think you should either have a $75 decongestion facial that's just basic without any modalities, or have a clinical decongestion facial that incorporates whatever modality your client might need. Some clients might need the cold hammer. Some clients might need high frequency. And then some clients might simply benefit from LED light therapy. And so gauge your treatments based on what could fit every individual, and then also what you have access to. But just remember, nothing under 75, and I would say the range is from 75 to 150. Keep that in mind. So what you see me doing here is prepping my client's skin with some desincrustation solution. Desincrustation solution is usually an alkaline solution that helps turn the oils in the skin into soap. It makes extractions a lot easier. Okay, so as you can see, this client has a lot of scar tissue, and you're about to see how much oil, dead skin, and I don't know what else, because we don't even know what else could be lodged into her pores, lodged into the scar tissue, but you're about to see all of that come out of her skin. I'm using the vacuum, and the vacuum is a good tool for clients who have severely oily skin. The vacuum should not be used on clients who do not have oily skin. The vacuum should not be used on clients who have dry skin at all. It's more of a tool that helps get out any oil, any sebum that could be hiding in between the skin cells, right? So you wouldn't want to use this on somebody who has pustules and, comedones that are easily seen. You want to use this on a client who you don't want to skip over. Like, if you know your client produces a lot of sebum, this would be a good tool to use on them, mainly because you know that you can use the vacuum to go through their full face and not miss any areas that could be accumulating a lot of oil and sebum production. You also never want to use this on a client who has rosacea. So any client who has sensitized skin, or cuperose skin, you do not want to use this on them. Clients who drink a lot of alcohol, clients who are on blood thinners, clients who bruise easily, clients who drink a lot of caffeine, they are not good candidates for the vacuum. And I think I'm going to post a video of a client that had a really bad reaction to the vacuum, just so you guys can see, when not to use the vacuum. But I don't know if you guys were paying attention to how that tube looked before we started her extractions, but look at it now. There is a lot of gunk. That's the best way I can explain it. A lot of sebum, a lot of dead skin, a lot of gunk. lodged into the vacuum tube, and we're not finished yet. We just did the forehead and half of the nose. All right, so stay tuned. I am going to eventually switch over to manual extractions, but I just really wanted to cover majority of her face with the vacuum to see what I can get out first. So this is when I switched over from the vacuum to manual extractions. Look at that tube and what we got out so far. And now you're about to see me go in with my fingers to do her extractions. I want to give you guys a quick tip about manual extractions, especially on the nose. Whenever you're extracting on the nose, please do not press down on your client's nose. Or I even seen some people press upwards, take the whole entire nose and just push it up. You really want to be careful when you're working on people's skin in general. I know sometimes we want to just get in there and get it all out and, so it won't cause that much pain or so that you can hurry up and get it over with. But you do have to realize that these people are live models. They're not a dummy. They have feeling, and you don't want to cause too much discomfort to your client's skin, or they're probably not going to come back to you. All right, so just make sure when you're working on a client's nose, you're manipulating their nose to where they can still breathe and to where you're not bruising them or causing too much discomfort, because this is already as uncomfortable as, I'm not going to say it's as uncomfortable as it can get, but it's already uncomfortable in general. So be very, very, very intentional when you're working on your clients and extracting their skin. Don't press down too hard. Don't cut off their breathing. Just try to find a way to maneuver without pressing their nose down or pressing their nose up in a way where it's going to be really uncomfortable. Take your time. I usually like to work on and isolate one area at a time instead of trying to do one full area at once. It is a little hard to find out, what works best for you, especially when you're using your hands. In the book, it tells you not to use your nails to dig into people's skin. However, my secret is, and I always joke about this when I'm teaching extractions, my secret is to keep my thumbnails a little sharper than the rest of my fingernails, mainly so that I can use it as a plate to guide out the congestion. I'm not using it to, pierce their skin, but I'm using my thumbnail just to guide it out, kind of like a shovel. All right, so that's how I use my fingers. Whenever I do have deep comedones, I'll just go in and use the metal extractor. There's nothing wrong with using the metal extractor. But practice does make perfect, and you do have to create a technique that's going to be comfortable for you and your client. I do intend on doing a more educational video about hidradenitis suppurativa. However, hidradenitis suppurativa, if I could talk a little bit about it, it is pretty much an inflammatory disorder of the hair follicles. Any area that is capable of producing hair, so anywhere where there's skin practically, could potentially have these inflammatory boils and nodules and, these different bumps of inflammation. And as we see here, like, there's a lot of scar tissue, and I'm guessing there's a lot of scar tissue because of those different cysts, different pustules, different nodules that came from her having the hidradenitis suppurativa. And this condition, it can spread. And so I think that's where most of this scar tissue came. It probably came from those nodules spreading under her skin, those bumps of inflammation spreading under her skin. It has absolutely nothing to do with hygienic practices, even though, not keeping your skin clean could worsen the condition. But it has a lot to do with hormones. Hidradenitis suppurativa has a lot to do with your diet, has a lot to do with genetics as well. All right. So like I mentioned, this was my first time seeing it on someone's face. It's usually found in areas that grow a lot of hair. However, your face still has hair follicles. All right. And so anywhere that there is skin, even though it might not produce hair strands, your full body is covered in hair follicles, with the exception of the palms of your hands and the soles of your feet. So anywhere that could produce hair could be affected by this condition. And so I'm not surprised, after doing further investigation, further research, I'm not surprised that she was diagnosed with hidradenitis suppurativa on her face. But it's just not something that is very common when it comes to this condition. This condition is very common, but I never came across this on someone's actual face. All right. So to help with the scarring, there's so many other different treatments that could be done for her. But like I mentioned earlier, we want to give her skin a clean slate before we start exploring those other options. And I'll talk about those other options shortly. Let's continue to watch me do these extractions. Something I also want to talk about is the amount of oil that we see her skin producing. This is also triggered by hormones and genetics as well. It's also triggered by, the foods we eat and all that good stuff. But as an esthetician, if you're really into the human body and anatomy and how it works, you know that the human body is interconnected. So whatever you eat affects your hormones, things like that. Whatever you take in, it affects your skin cells, and it affects how your skin thrives, whether it produces acne or whether it's dehydrated or dry and things like that. So the body is interconnected. And I think that if you're going to be offering clinical services, or if you're going to be treating people with acne, treating people with rosacea or any kind of skin condition, do your research to know how the body works. All right, look at all of that oil. After we did extractions, I did go in with an antiseptic just to tone her skin and sanitize her skin after extracting some pustules and, possibly opening up some of those pores. That antiseptic is going to sanitize the skin. It's going to reduce any bacteria on the surface so that we can prevent future breakouts. This is not something that should be skipped. If you don't have access to, a Dermalogica antiseptic, that's okay. There are other antiseptic options. I wouldn't use alcohol. Alcohol is, pretty strong, but you could use witch hazel. You could even use a few antiseptic cleansers like Heavy Cleanse, and that's a good option for your client to even use at home. Heavy Cleanse, High Clodex, Witch Hazel, all of these different antiseptics can be found at your local CVS, Walmart, any kind of pharmacy. Those are good to keep in your back bar, especially when you're doing a decongestion facial or when you're working on acneic skin, when you're preparing for microneedling and even chemical peels in some cases. I'll provide a link to some of the ones that I recommend in the description of this video. After doing your extractions, you can go right into toner, serum, moisturizer, and SPF, or right before you do those final steps, you can go in with LED light therapy, high frequency, the cold hammer, just to rehabilitate the skin like I mentioned before. Those different modalities won't heal that scar tissue. A chemical peel, depending on the strength, won't even heal that scar tissue, but it could aid in cell regeneration. Something that would really help this client with the ice pick scars and the box scars, these are like the little craters that we see on her skin right now. Something that would help reform that skin tissue would be microneedling, and maybe even microneedling paired with something like radio frequency. Lasers might even help, but these are like extremely clinical services that most estheticians could not do. However, I always recommend, us connect with different physicians, different nurses to expand our practice. However, estheticians in some states, they can have a laser license. They can do certain depths of microneedling. So look into your state regulations and what they allow, and see if they do allow you to do certain depths of microneedling or even allow certain laser licenses. If they do, then this would be something that could help a client who's struggling with hidradenitis suppurativa, but the scars from the hidradenitis suppurativa, like which we see here. All right, so what I'm doing right now is applying a conductive mask to my client's skin because I'm preparing her for a little bit of LED light therapy before we nourish her skin back to health, before we do her serums, her moisturizer, and SPF. The conductive gel helps the electricity from the LED light therapy absorb directly into the skin to target the skin cells, to target any bacteria on the skin, and to target any pigmentation found in the skin. All right. And so anybody who knows me knows I love to conclude a lot of my treatments with LED light therapy just to put a cap on all that I did. I'll be using blue LED light therapy and red LED light therapy, alternating in between the two. The blue LED light therapy helps to kill any bacteria on the surface and reduce any inflammation, while the red LED light therapy helps to stimulate cell renewal, and it also helps to stimulate wound healing. Once the LED is finished, you can go in with your toner, your serum, and finally conclude with your moisturizer and SPF. This was a very quick service, but do not underestimate the power of decongesting your client's skin before moving on to any corrective facials. I hope this helped. Feel free to reach out if you guys have any questions. See you soon.